Welcome, everyone, to this special episode of On the Safe Side, a podcast hosted by the editors of Safety and Health magazine, the official publication of the National Safety Council. My name is Barry Botino, and I'm an associate editor with Safety and Health. I'm joined by my editorial colleagues, Kevin Drewley and Alan Ferguson, to kick off our four-part National Safety Month 2022 podcast series. Throughout National Safety Month, the National Safety Council is offering free resources to the public, such as infographics, fact sheets, articles, a social media kit, and much more. NSC members also will receive exclusive posters, tip sheets, safety talks, and webinars, plus additional resources to keep workers safe not only this month, but all year long. You can access NSC's National Safety Month resources at nsc.org/NSM. During our National Safety Month series, we'll focus on a different topic for each week of June. For this week one episode, we will discuss musculoskeletal disorders with two National Safety Council experts on the topic, Lisa Brooks and Ram Michaela. Lisa is the director of EHS Networks here at NSC, and Ram is the MSD Solutions Lab Program Technical Consultant. Lisa and Ram, thank you so much for joining us on the Safe Side.
Thanks for having us. It's wonderful to be here.
Thank you for having us, Barry.
What are some of the most common musculoskeletal disorders that occur in workplaces?
As you know, the workers experience, MSDs or musculoskeletal disorders in the upper limbs, back or lower limbs. Upper limbs typically neck, shoulders, and arms, and lower limbs typically hips, knees, and ankles. So the question is, the MSDs, as you said, they are the injuries or disorders of the muscles, nerves, tendons, joints, cartilage, and spinal disc. We have sprains and strains. We hear tennis elbow, which is more of a tendon-related, carpal tunnel syndrome, which more of a nerve-related injuries, and obviously the back pain, where the pain can be attributed to various structures that surround the spine. The muscles and tendons surrounding the spine. We have the ligaments connecting the vertebrae, and the discs that act as a cushion between vertebrae, and the fascia joints that allow mobility and the stability of the spine, and you have vertebral bones and the blood vessels. These are the typical MSDs we see in the workplace, anything related to upper limbs, back, or lower limbs, to summarize.
Ram, if I could add, these are a really big deal in industry. So in looking at the data, that in 2019, there were nearly 270,000 cases in the U.S. So this is really the largest category of injuries and illnesses in the U.S. And it really is a pervasive issue worldwide. There's approximately 1.7 billion people suffering musculoskeletal disorders across the globe, according to the World Health Organization. And this issue is costing businesses billions of dollars every year. And unfortunately, this issue is not going to go away anytime soon because as a population as a whole, we're aging. And as we age, the number of these musculoskeletal disorders unfortunately increases. So this is going to be with us for a while. So it's a good thing that the National Safety Council is really digging into this issue and providing resources to address this pervasive issue across businesses.
What safety and health strategies or interventions have been proven to make an impact?
Well, that's a great question. When you look at musculoskeletal disorders and workplace exposures, you really look for these things called risk factors. These risk factors increase the likelihood of experiencing a musculoskeletal disorder. And the three primary risk factors are force, repetition, and posture. And more specifically, say high forces, awkward or static postures, and excessive repetition. So in terms of interventions, we try to identify where are those risk factors, where are the employees exposed to high forces, static and awkward postures, extreme or excessive repetition, and then design them out, redesign the task, follow the hierarchy of controls in redesigning to eliminate the task or redesign the task to minimize the exposure to those risk factors. And I think Ram's going to add a little more explanation on the hierarchy of controls.
Good point, Lisa. Actually, if you go back to hierarchy of controls, NIOSH recommends it. Bottom line is the very first thing we have to do is eliminate the hazard. If you think there is a problem, let's say if we know that a job that demands heavy lifting, let's see if we can eliminate the heavy lifting completely. So you're eliminating the hazard. If that's not possible, right, find a substitution. Okay, reduce the risk of the load using lighter weights, for example. Okay, or go for engineering solutions, such as Lisa pointed out, redesign the job. If that's not possible, use administrative controls. Okay, so make sure the workers get an appropriate strategies to get a proper education or a training to perform the task. If all else fails, in the hierarchy of controls, at least provide personal protective equipment, gloves, or slip-resistant footwear. And NIOSH, and the CDC recommends prevention to design, or PTD, as a part of the hierarchy of controls. As Lisa pointed out, the emphasis is designing out the hazards. Okay, and that is very, very important so that we can eliminate the MSDs.
How did the approach to MSDs change as many workers were remote, especially early during the COVID-19 pandemic?
That's a good question. If you look at a majority, if you're looking at the remote work, I can say that, it's more of an office-related work as compared to, say, manufacturing or a distribution. Most industries, unfortunately, there was no written policy or guidelines per se for this new normal life of remote work. Employees ended up utilizing whatever they had at home or in their virtual office space. Some went for innovative approaches, as you know, such as working from dining tables, foldable ironing board. The problem with that is that, as Lisa pointed out, the risk factors, force, repetition, or the posture went out of the window. You saw quite a bit of increase in MSDs and obviously the Zoom fatigue as well. So majority, the office workspace, when we moved toward working from home, a lot of MSDs started coming out because we didn't have a proper workstation at work.
The most obvious connection was creating offices and office environments in people's homes and providing ways to do that and minimize the exposure to the risk factors. But we would be remiss if we didn't talk about the challenges that were faced for those who didn't work remotely, who were left working in the workplaces, the essential workers, both in manufacturing and in retail. We experienced short staffing and staffing shortages like we'd never seen before. So those who were still in manufacturing often were working longer hours. They were working with less people. So their exposures to the forces, postures, repetition, and their duration, the length of time that they were exposed, made dramatic leaps, increases over the pandemic. So it was really challenging both for those working remotely and creating new workspaces, as well as those who stayed in the workplaces because they were faced with different challenges, particularly at its root were staffing levels and getting additional folks. So this has been a trying times. We expect that in a couple years, when we see really how this impacted our overall numbers of musculoskeletal disorders, that we probably experience a significant jump. So again, the effort that the National Safety Council is placing on understanding and addressing musculoskeletal disorders is really important and timely.
How can workers help in interventions targeting MSDs?
Ooh, that's a great question. So worker involvement is really one of the fundamental pillars of an effective ergonomics program. Now, the employer is responsible for establishing the systems to identify, prioritize, and address the risk factor exposures to the workers. However, it can only be done effectively, or can be done much more effectively, if the worker is involved, if their input is solicited for identifying where are the biggest and hardest jobs, what are the potential solutions for those jobs. So we really have to have systems in which we engage our workforce. They do these jobs every day. Believe me, they have a lot of time to think about ways to improve it. It's important for the employers to provide avenues to get that input, and it's important for the workers to share their thoughts. The other component that's really important is for workers to communicate with their leadership when they are experiencing signs and symptoms of a musculoskeletal disorder, because we need to provide the company the opportunity to fix things before the signs and symptoms actually elevate into a full-fledged musculoskeletal disorder that requires serious treatment and or time away from work and or surgery. So this is an important question because any effective ergonomics program has employee worker input as one of its core components.
I agree with Lisa, actually. I think this has to start from the top. That is, the employer or a management, they should demonstrate that they care about their employees. If you look at the recent systematic review from Sweden, they said that, training the workers to be peer coaches is associated with fewer MSDs. The authors also suggested that, participatory ergonomics and the management engagement in collaboration with the workers, identifying the barriers and mitigating the injuries at work, which is very important. So if I go back to, again, participatory ergonomics, we know that, workers are the ones who know the best possible solutions for their work-related issues, getting input, as well as the ideas for engineering out the hazards. I think getting all the stakeholders, variety of stakeholders getting into in terms of developing interventions, I think that's the key. Just sort of giving a very good example from my recent work in healthcare, where we looked into a safe way of proning the COVID patients. Simply proning is flipping the patient from the back onto the stomach, which is typically done with the 8 employees. It's very taxing on the caregivers or the employees. So what we used is, just to prone a patient, we used a ceiling lift. Sometimes we used a mechanical floor lift so that we can perform this task without much exertion to the employees. That's where we use the participatory approach. Again, this is a perfect example of employee engagement to prevent MSDs.
In what ways is technology changing how organizations and researchers confront MSDs on the job?
This is a very, very important question. As you see that, the much focus now is placed on technology in MSDs prevention discussions. We all heard of Industry 4.0. Majority is technology driven, but now people are talking about Industry 5.0. That is where human centric, anything you design, you need to focus on who is taking care of the work. So the most recent surge, if you go back to the technology, is exoskeletons, exosuites. These are the best examples of preventing MSDs. And same with the wearable sensors that measures physiological and biomechanical responses. You're monitoring the worker, even on the floor or remotely, we are using the wearable sensors. Extending further, nowadays you see use of AI, artificial intelligence, machine learning, computer vision, industrial and collaborative and service robots. And all these technologies are rapidly being developed, to support risk decision making and the development of MSD risk reduction strategies. It's very important. It's a very good question because I think we are going towards technology in changing how we can confront the MSDs. But the problem with technology is that, comes the privacy issues, safety, security issues. So I think we need to look into all aspects when we are going for technology-driven solutions.
Yeah, that's great. And the neat thing about there's just so many new technologies being developed every day. And we are finding new ways to use these technologies to solve musculoskeletal disorder issues and reduce the exposures to employees. The neat thing is some of the technology is also being used on the risk identification side of things. So some of this AI is being used or technologies which analyzes employee movements and motions and helps us as safety professionals identify where are the biggest issues. And we use that information, combine it with what employees tell us to focus on where we want to start making improvements in the job. So it's helping us reduce exposures to workers and our employees and also helping us figure out where the biggest problems are. So we are really at a neat time in the discipline of ergonomics and MSD prevention and really starting to use technologies in new ways. What can be done today versus 10 years ago is absolutely amazing.
Well, thank you, Lisa and Ram, for joining us for this special National Safety Month podcast series. To our listeners, we appreciate you spending some time with us, and we thank you for all you do to keep workers safe. Be sure to check out our other special episodes this month at safetyandhealthmagazine.com/podcasts. And please stay on the safe side.
Hello, everyone, and welcome to this special episode of On the Safe Side. My name is Kevin Drewley, and I'm an associate editor with Safety and Health magazine, the official publication of the National Safety Council. I'll be your host for Week 2 of our National Safety Month 2022 podcast series. Throughout National Safety Month, the National Safety Council offers free resources to the public, such as infographics, fact sheets, articles, a social media kit, and much more. NSC members also will receive exclusive posters, tip sheets, safety talks, and webinars, plus additional resources to keep workers safe this month and all year long. You can access NSC's National Safety Month resources at nsc.org/NSM. This week we'll discuss workplace impairment with Rebecca Martin and Claire Strohr, who work as program managers of the Impairment Practice Initiative at NSC. Welcome, Rebecca and Claire, and thank you for joining us on the Safe Side.
Hey there, Kevin. Glad to be here.
The National Safety Council has asked employers to take a broader approach to addressing the issue of workplace impairment, recognizing that chemical substances aren't the only potential avenues for inhibiting workers' ability to function normally and safely. With that, which physical and social factors should be considered as forms of impairment, and why is it an important step for employers to take this more holistic view?
That's a really great question. I think that we're recognizing that people bring their whole selves to work. There's no such thing as just an employee anymore. There's an employee and their whole life, inside and outside of work. So when we think about impairment, we also want to think about that holistically as something that's getting in the way of doing our work to the best of our ability, particularly if we're in a safety-sensitive position. So when we think of impairment, we oftentimes think first about alcohol, opioids, or cannabis. And these are all impairing and hazardous for workers and workplaces. But alcohol and drug use are really only part of the big picture of health and well-being. So mental health issues like fatigue and grief and stress are all potentially impairing. Anxiety, depression, trauma can all be potential causes of impairment too. We even have diverse factors from bullying, harassment, racism, to musculoskeletal injuries and pain that can all impact our health and well-being and can contribute to impairment. So we need to really holistically support employers so they can holistically support employees. It's easy for us to think that impairment is an other people problem or not happening in our workplace, but the reality is that the issues that can lead to impairment, like substance use and mental distress, are everywhere and can happen to any employee. So we need to have comprehensive and holistic solutions and supports. And helping employees is not only good people practice, it's also good business practice. So for every $1 we invest in mental health treatment, we get a $4 return in improved health and productivity. So really thinking about how we look at impairment in employees can really impact our bottom line as well.
In what ways has the COVID-19 pandemic exacerbated substance misuse and mental health issues in the workplace?
This is in some ways a tough question because I think we're still learning all the ways the pandemic is impacting us. I don't know that we'll know the full extent until some time from now. But what we do know already is that the pandemic made the issues impacting the workforce prior to the pandemic worse, like lack of childcare, disparities in access to healthcare, access to mental health treatment, and access to substance use treatment. COVID created deep stress, uncertainty, fear, and anxiety, not to mention the grief and trauma for the family members of those who lost their lives to COVID. And the pandemic really exposed the gaps and holes in our safety nets across all communities in America, and that absolutely impacted our workplaces. And alongside the COVID pandemic, we have what's kind of been called a twin pandemic of substance use and drug overdoses. The preliminary numbers from the CDC are pretty staggering, that more than 100,000 people died from a drug overdose from spring 2020 to spring 2021. The CDC has also said that 13% of Americans reported starting or increasing substance use as a way of coping with the stress related to the pandemic. And it's a global pandemic, so it's not just the US that's impacted either. The World Health Organization reported that worldwide anxiety and depression increased by 25% from spring 2020 to spring 2021. The pandemic has really shown a pretty harsh spotlight on the mental health and substance use issues impacting people everywhere, including right here in our workplaces.
Claire, what should employers know and do to better recognize and respond to impairment in the workplace?
I think the most important thing is what Rebecca had just started talking about at the beginning of this podcast, is thinking about this issue holistically. So that's step number one, making sure that you're not, having an isolated approach to how you're addressing these issues. And in order to recognize and respond to impairment, it's really important to get your employees trained, especially those supervisors, because we really see supervisors as the first line of defense. And when we're talking to those supervisors and whatever you're doing in your workplace to train employees, it's important not to jump to conclusions as to why someone might look like they're impaired, because it's important to really emphasize that you don't need to know the cause of why someone's impaired in order to respond effectively. We do have a new training at NSC that I'd like to give a shout out for. It's our impairment recognition and response training for supervisors that we just launched recently. And it's a really valuable training because it emphasizes those safety and well-being concerns that maybe aren't always so prevalent in other trainings that are out there to address reasonable suspicion. So this training really equips supervisors with the skills they need to recognize and respond to impairment. There's a lot of skill building activities that can really drive these skills in and really emphasize those. And something that's important to note too is when we're talking about all these different issues, we don't need supervisors to be, drug recognition experts in the workplace. So what we did to help with that piece of recognizing these different factors is breaking down the signs and symptoms of workplace impairment into physical, cognitive, and performance indicators. Instead of having supervisors or other workplace professionals who might be taking a training, understanding and memorizing a list of the signs and symptoms for fatigue versus for opioids, I'm really taking a higher level approach, because at the end of the day, it's important for supervisors to be able to connect with their employees to know when something might be going wrong. And when you're responding to impairment, it's really important for employers to have policies in place so that supervisors and others in the workplace know how they're supposed to respond, given what the employer needs them to do in order to do that appropriately, especially keeping those legal considerations and confidentiality concerns in mind. And I'll also add that within that process, we really encourage for employers to have resources, especially if they're dealing with impairing issues that might need treatment, for example, or other supports such as accommodations, so that they can really get those employees back to working safely and that they're well. Since Rebecca, like she was talking about earlier, it's important to have employees caring for them throughout the process, both on and off the job.
Which specific resources are available to help?
The training that I mentioned is, I think, the best top of mind resource to mention. It's the impairment recognition and response training for supervisors, and you can access that at nsc.org/impairment training. But we do have a number of other resources before you even implement a training. If you're looking to take a step back and maybe get some more assistance with developing policies or maybe educating your workforce on all these different issues, we have a number of free toolkits at NSC on these different topics. The two I'd like to highlight are Opioids at Work Employer Toolkit and our Fatigue at Work Employer Toolkit. And within those toolkits, you'll find anything from, implementation plans and communication plans, PowerPoint templates that you can use for safety talks, and then also some free policy templates as well that you can really plug and play to add into your workplace planning.
How can someone begin to overcome the stigma of asking for help?
Well, I think that's an issue in and of itself, but I think it goes back to the first question about holistically supporting employees. So we need to create workplaces that are also holistically safe, not just physically safe, but psychologically safe. So a message of you're not alone and you're safe is not really enough without policies and resources to support it. So there's programs available to help workplaces address stigma. So even resources that Claire had just talked about. So our toolkits that we have on the website for opioids and fatigue also talk about stigma. We also have other partners like Shatterproof that has resources and evidence-based services talking about stigma. I think the biggest thing to think about is that mental health and substance use are issues that impact every one of us. So we need to both model anti-stigma behaviors and create psychological safety among each other while simultaneously building the systems and implementing policies that holistically support our workforce. Claire, I don't know if you have other resources that you wanted to mention too.
No, I don't think I have anything specific. That was a really good answer, Rebecca. And I think something that I'll just add to is it's important to talk with your employees about when they should be coming forward, even thinking about things like prescription medications that might be impairing, but they might not even be aware of that they need to report to their employer, because especially if they're in a safety-sensitive job, making sure that you're outlining those things in your policies. So even when you have that positive workplace culture, that employees are aware when they need to have that conversation regardless.
And you can also involve EAPs or healthcare providers too in some of those discussions as well, creating that atmosphere of it's okay to talk about it, including the supports that you might have available too.
Thank you so much, Rebecca and Claire, for joining us for this special National Safety Month podcast series and for sharing such great insight and expertise. For our listeners, we appreciate your interest in helping to keep workers safe. Be sure to check out our other special episodes this month at safetyandhealthmagazine.com/podcasts. Thank you as always, and please stay on the safe side.
Welcome, everyone, to this special episode of On the Safe Side. My name is Barry Botino, and I'm an associate editor with Safety and Health Magazine, the official publication of the National Safety Council. I'll be your host for this episode, which is week 3 of our National Safety Month 2022 podcast series. Throughout National Safety Month, the National Safety Council is offering free resources to the public, such as infographics, fact sheets, articles, a social media kit, and much more. NSC members also will receive exclusive posters, tip sheets, access to safety talks and webinars, plus additional resources to keep workers safe this month and all year long. You can access NSC's National Safety Month resources at nsc.org/NSM. Increase the productivity of your safety inspection teams with Fulcrum, our sponsor of this podcast episode. Managing today's safety programs means overcoming a number of challenges: more projects, sites, and assets, more safety compliance requirements, and smaller teams, many with limited experience. That's where Fulcrum can help. Fulcrum's field inspection management platform allows you to digitize inspections, tasks, and issues, and proactively manage them throughout your organization. Fulcrum also has a new issue reporting capability that allows anyone on site to report issues via a QR code. With Fulcrum's field inspection management platform, you at last have the end-to-end visibility and control you need to optimize the productivity of your safety inspection teams. To learn more, go to fulcrumapp.com. That's fulcrumapp.com. This week, we discuss injury prevention with Joanne Dankert, a senior safety consultant for NSC. Joanne is a veteran safety professional who specializes in safety and health compliance, training, safety management system assessments, and compliance audits. Joanne, thank you so much for joining us here on the Safe Side.
Hey, Barry, thanks for having me.
Joanne, where we're going to start with you is when it comes to injury prevention, where should employers start?
First and foremost, they gotta wanna. It's part of the overall commitment that they have for safety and health, that they want to do some hazard recognition and control of those particular hazards, whether an employee brings them up, whether they see it in a safety audit or some other sort of walkthrough. When we're talking about prevention, it's really that commitment on some proactive activities. And then should they have an incident, they're going to do a good incident investigation and get to the root cause, close those gaps, and communicate those corrective and preventative actions to employees.
What are the biggest hurdles or challenges to effective injury prevention?
Barry, it comes kind of back to what I said about that personal commitment. You know, one of the things that's really, I think, hard for leadership is they're in that leadership position, you know, upper management position, or even frontline leader like a supervisor or foreman, because they can get things done. And often they have to get things done through other people. And so they're used to delegating. And safety is one of those things that you really need to have a connection with the workforce. You can't just talk about safety when something bad happens on the job site or the plant floor. And so if they can regularly participate in supporting safety and health activities, safety inspections, training events that they might have, just some sort of regular communication, if you will, is, I think, super important. Also, that they do take action. If an employee brings up a suggestion, can they ensure that it's taken care of? I understand not every employee is going to give us a great idea or concern. And sometimes employees can be a little bit self-serving, i.e., you know, the light is out and they'll try to make it a safety hazard, or really maybe it's just important to some other aspect of the organization. but they know if they make it a safety concern, it'll get acted upon. So you're right. There's going to be some suggestions that employees make that really aren't safety related or take a longer time to implement. And so just making sure that we can keep employees up to date on where we are, right? We might have to wait on parts, or we might be waiting for a particular time, like a long holiday weekend, in order to make a change or put a corrective action or control in place. So through their participation, asking questions, are things being taken care of? Can we close this out? And I think also appropriate measuring of progress, whether it's how long does it take us to close out a safety concern or something that we find on an inspection, as well as maybe something that's a little bit more reactive around incidents or injuries or illnesses that have happened on a job site.
What injuries do you recommend that employers focus on the most?
It's going to be different for every organization. One of the reasons why OSHA asks us to complete an OSHA 300 log is, in a way, and this is kind of a strong word, but it forces organizations to trend. Where are we having the most injuries? In a particular area, department, line, task, certain time of the day. Maybe you have somebody who I tend to call an injury repeater. They're good for a couple of injuries during the course of a year type of a thing. And so that trending can help us not only be reactive, fix what's broken, but also put some proactive activities in place to help identify hazards and close those gaps, corrective actions, controls, and so forth. I also think that employers can focus on, again, what employees recommend or what their issues or concerns are. Every year at our Congress, we have somebody from OSHA that speaks to us about OSHA's top 10 most frequently cited. We see a lot of our customers and members focus on, well, what is OSHA looking at? And those OSHA top 10 are usually a mixture of general industry standards that they've cited and construction industry standards, but we can see most definitely what OSHA is focusing on. And that helps us then to be able to maybe take a deeper dive in that process, if that is on one of my job sites or in one of my facilities. Be prepared, if you will, when OSHA knocks on the door.
What role can employees and management play in injury prevention?
It is a partnership, Barry, between employees and management. I think sometimes it's easy to focus more on the employees, but there's definitely some things that the management or the employer can do. And I kind of sound like a broken record here, right? This is the third time I'm going to focus on what do employees say. I think when employees tell us concerns and we act on them, it's almost like putting a deposit in the bank account, right? Not only do they feel heard, but they also, I think, get some confirmation. The idea was a good one. And as an organization, we've taken some action with that. I think employers control the work. So anything that an employer can do to standardize work and then incorporate safety and health policies or procedures. If you have a basic operating procedure, a BOP or an SOP or a work instruction, can you list the PPE associated with that? But prior to starting this task, you need safety glasses, safety shoes, and hard hat, or whatever that is. As the employer, integrate safety into the overall task of the job, right? That sends, I think, a deep message to employees about how the organization thinks about safety. And then the employer definitely has the opportunity to design work with safety and health in mind, whether we're talking about adding a line or buying new tools and equipment. There's the opportunity, I think, to get employees involved in that process and get some feedback, not only on productivity or quality concerns, but what might be the issue or problem with regards to safety and health. Employee side of the house, though, right? We said this was a partnership. It's important for them, if they see something, to say something. I think sometimes employees feel like, well, I don't want to rock the boat, or I don't want to cause an issue or a problem. But the opportunity for them to say something, and if they can, take some action on their own to remedy the situation, or if it's too much for them, right, that they tell their frontline leader, their supervisor or foreman, Maybe they have a safety team or a safety committee member in their area or department. The opportunity for somebody to know that something is amiss here and needs to be looked at. The same thing holds through with regards to how work is done. Follow the procedures. Sometimes I think, can be a perception on the employee's part, perhaps to save time, I'm going to do this a little bit different. And sometimes, yes, it does save time, but it could also put them in harm's way. So it's important for them to follow the training that they've been given to do a job or task. And again, the opportunity to speak up if perhaps as the supervisor or foreman, we've missed some sort of safety issue or concern that could make that policy or procedure a little bit better. What we're really talking about is employees wearing personal protective equipment or making sure they follow the controls that have been put in place, like machine guarding or lockout, tagout procedures. And that, I think, sort of keeps that line of communication open between employers and employees.
What resources are available out there?
Most definitely, we can go to OSHA, www.osha.gov. Lots of resources there. And it's a pretty easy website to navigate. There's a search box in the top right-hand corner. They have topics listed A to Z. OSHA also has a consultation program for small businesses, 250 employees or less. There's some strings attached with consultation in that if OSHA finds a safety and health issue, we would agree to correct it as the employer, but it can be very helpful. Many organizations work with their insurance broker or insurance company provider through workers' comp insurance. Lots of times they have loss control reps that are coming in and can most definitely help you with issues, problems, concerns, provide training, things like that. There's industry associations for particular types of industry. If we're talking about construction, if we're talking about chemicals, things like that. If you have an organized workforce, you could perhaps even look to the labor unions. Large labor organizations have safety and health staffs at a national level that can help or assist. And then, of course, there's us at the National Safety Council, www.nsc.org. We have a lot of free resources, webinars, podcasts like this that can help people kind of get in the right direction.
Well, thank you, Joanne, for sharing your insights with us and for joining us for this special National Safety Month podcast series. We appreciate our audience for listening and for all you do to keep workers safe. Be sure to check out our other special episodes during National Safety Month at safetyandhealthmagazine.com/podcasts. And please stay on the safe side.
Welcome, everyone, to this special episode of On the Safe Side. This is Alan Ferguson, Associate Editor with Safety and Health Magazine, the official magazine of the National Safety Council. I'm also your host for the final week of our National Safety Month 2022 podcast series. And throughout National Safety Month, the National Safety Council offers free resources to the public, such as infographics, fact sheets, articles, a social media kit, and much more. NSC members also receive exclusive posters, tip sheets, safety talks, and webinars, plus additional resources to keep workers safe this month and all year long. You can access NSC's National Safety Month resources at nsc.org/NSM. This week, we're discussing slips, trips, and falls with David Consider, Senior Safety Consultant at the National Safety Council. Our listeners may remember that David and fellow NSC Senior Safety Consultant Joanne Dankert appeared on Episode 9 to talk about powered industrial trucks. So, David, thank you so much for joining us once again here on the Safe Side.
Yeah, always great to partner with you and our listeners on these podcasts. Thank you so much for this opportunity, Alan.
First question, let's start with falls from heights, which are the third leading cause of workplace fatalities, according to NSC's injury facts. What are the common problems or issues that lead to these kind of falls?
Let's first put this topic into perspective with some facts and data, if I may. So following highway crashes and intentional injuries by persons, falls to a lower level is the third leading fatal workplace event, just as you pointed out, and the fifth leading event resulting in cases with days away from work. Historically, falls are the leading cause of fatalities in construction. Furthermore, falls can cause more deaths in construction than any other hazard. Matter of fact, accounting for about 1/3 of all of our fatalities in the industry. And a worker doesn't have to fall from a high level to suffer fatal injuries. Though construction workers are most at risk for fatal falls from heights, matter of fact, more than 7 times the rate of other industries, but falls can happen anywhere, even at your typical desk job. Now, as far as the common problems or issues that lead to these, we must recognize that these incidents involving falls are generally complex events, frequently involving a variety of factors. And consequently, we must deal with both the human and equipment-related issues in protecting workers from our fall hazards.
So, David, what are some ways employers and workers can help avoid those issues?
Specific recommendations to help avoid these issues, we would conduct a hazard assessment for each job or task as necessary, such as our infamous JSAs, job safety analysis, or job hazard analysis. We could develop a corrective action plan, which is going to tell us how we're going to abate hazards and prevent employee exposure. We could provide safety training for all of our employees so our workers can recognize and avoid those unsafe conditions and ultimately control or eliminate those hazards that they see and that we see in the workplace. Some other ideas: we could hold frequent crew safety meetings, such as tailboard or tailgate meetings. We need to ensure that we're utilizing appropriate personal protective equipment, and we can do that by conducting a PPE hazard assessment. We could utilize a stop work program or something similar to that. As far as supervisors, we need to make sure that all of our supervisors are trained as well and familiar with the applicable OSHA standards. We should also ensure that our supervisors are conducting informal reviews of the workplace conditions to ensure that the site is relatively free of unknown or suspected hazards and that employees are adhering to company safety policies and procedures. From a regulatory perspective, and if that is applicable, employers may be required to create a site-specific fall protection plan, which is going to lay out specific details, such as where employees are going to tie off and where guardrails are going to be, as examples. And lastly, we could have a fall protection permit system in place, focusing specifically on fall protection during inspections and in order to plan for those potential falls in those risky areas.
As you and I both know, NSC's Work to Zero website, available at nsc.org/work-to-zero, details some technologies that can help regarding falls from heights. What are some other helpful resources out there?
Some other resources that could be available, we would recommend consulting with professionals and having them assess building designs to figure out where those fall exposures and where those workers and end users are at risk. We could also direct you to OSHA's website, osha.gov. They also have some great OSHA consultation programs for smaller businesses. I'd be remiss if I didn't mention NIOSH. NIOSH also has some great tools out there. That's the National Institute for Occupational Safety and Health. We could also use our workers' compensation company or our insurance broker, right? That loss control representative that comes out and that's partnered with our companies. We could look at industry associations and network that way. Perhaps there's labor groups out there, depending on your industry, or unions. And of course, the National Safety Council.
When it comes to slips, trips, and falls at the same level, what are the common problems or issues that lead to these incidents?
First, let's take a look from 30,000 foot view. And identify some of those problems or issues that we may see there. Perhaps we don't have the upper management or leadership visible support and commitment. Perhaps we're not involving our employees in the process or the program. Perhaps we're not providing our workers with the correct tools and equipment to perform the job safely. We could have a lack of training or insufficient training. And then we need to ask ourselves, do we have any enforcement out there or coaching moments on the spot when we see an unsafe hazard or a condition when it arises? If we take a step back and go to a 10,000 foot level, specifically some of those common problems and issues that lead to these fall incidents could be workers disconnected from their lifeline. Perhaps they're working around unprotected openings or skylights. They're using defective equipment. Perhaps they're overreaching, maybe standing on top of or on the top step of a stepladder, placing the ladder on unlevel footing, using a ladder on top of a scaffold, or perhaps standing on those guardrails on a scaffold and or possibly climbing on the cross braces, just to name a few.
What are some ways workers and employers can avoid those problems?
Well, first and foremost, I think it's important for us to realize that these falls are 100% preventable. Whether we are working from a roof, from a ladder, or a scaffold, it's important for us to plan ahead to get the job done safely. We must also assess the risks and provide and use the right equipment. And lastly, we got to train everyone how to use the equipment safely. And let's also determine if working from a height is even absolutely necessary, or if there is another way to do the task safely. All this leads me into our infamous hierarchy of controls. When it comes to fall protection, ultimately what we want to ask ourselves is, are we able to eliminate this hazard completely? So in order to avoid falls, employers should coordinate the design with the architect, prefabricate in a controlled work environment, and perhaps ensure that possibly we can work at ground level instead of at a height. The next step in the hierarchy of controls is for us to look at substituting. As an example, maybe we involve a change in the sequence of activities or an adjustment in the project schedule. The next step in our hierarchy of controls really gets into that engineering controls bucket, which involves establishing an edge protection system, perhaps guardrails, maybe a safety net, just to name a few examples there. And then we look at the administrative controls. We could involve restriction of access to certain areas. Maybe we even set up warning line systems. And then lastly, in the hierarchy of controls, which we know is the least effective solution, is issuing our workers personal protective equipment, such as fall restraints and fall arrest systems.
Thank you so much once again, David, for joining us for this special National Safety Month podcast series. And thank you to all of our listeners. We appreciate you tuning in from wherever you are, and we appreciate all that you do to keep everyone safe. Be sure to check out our other special episodes at safetyandhealthmagazine.com/podcast. Most of all, please remember to stay on the safe side.